is Ms. Jennifer Nicklas, and she has served as the director of the Bureau of Nutrition Services in the Louisiana Department of Health's Office of Public Health since November 2018. She oversees the administration of 2 federal supplemental food programs for the state of Louisiana, the Special Supplemental Nutrition Program for Women, Infants and Chicks, the WIC program, Commodity Supplemental Food Program. We're going to be hearing a lot about that today. And she just has a wealth of knowledge in breastfeeding promotion and public health and nutrition, and very passionate about improving the quality of public health nutrition programs and advancing food and nutrition security for our most vulnerable population. So we're very excited to hear today's presentation, which will be provided by Ms. Jennifer Nicklas. So I will turn it over to you at this time, Ms. Jennifer.
Wonderful. Thank you, Lakeisha. And thanks everybody for having me today. Really excited to talk about this topic in particular. It is something, as she mentioned, I'm pretty passionate about. For the sake of, she introduced me beautifully. I'll just add, I have been with LDH for a little over 5 years now. I am a registered dietitian, so that's my trade background. The majority of my career has been spent in public health programs of some sort, and specifically in USDA food programs. I have worked in one or the other of all of the programs that I'm going to talk about in Tennessee and Colorado, and then of course back home for me here in Louisiana. So really excited to talk to y'all today. We're going to hit topics such as just some data around food insecurity in Louisiana. We're going to talk through different federal food programs that are available here in Louisiana, and then a little bit of a call to action. And I want to make sure too that you all have time to ask any questions, or if we want to have any discussions like the wonderful discussions we just had around community health workers, we'll leave time for that as well. Next slide, please. Okay, this is probably not new information for anyone, but I did want to put all of this information into one succinct slide. A couple of years ago, during legislative session, there was a Senate Resolution 77, which tasked the Louisiana Department of Health with convening a hunger summit, an anti-hunger summit, and then developing a recommendations report specific to tackling hunger and food insecurity in Louisiana. My bureau, the Bureau of Nutrition Services in the Office of Public Health, was the lead bureau in office in that Senate resolution and in that summit, as well as the recommendations report. Much of this data comes from that report. You'll note that it is a couple of years old. You'll also note that some of this data is coming from the time that we were moving into the early parts of the pandemic. And I think everyone here, and if you don't know, that we did experience some pretty significant increases, not just in Louisiana, but throughout the country related to food insecurity, access to food. And so these numbers probably don't even reflect what we experienced in 2021 and 2022. For the sake of this presentation, I did not have enough time. I never feel like I never have time to update a lot of the data. I would have had to pull a lot of different information and tap people, but I'm going to share the Hunger Summit report that we developed, again with the caveat that it's a couple of years old, but it's still relevant. Most of the information that I have in this presentation is from there. But Louisiana in general has the 3rd highest food insecurity rate. And when we talk about food insecurity is not having access to food regularly. So not just like nutritious foods, which I hit on in some of the programs that I'm talking about a little bit later, but just not having that basic need met, that basic need of food. So folks are hungry. They don't know where their next meal is coming from. They do need to rely on some of the federal programs that I'm talking about, or community resources that are available to them. So we do have the 3rd highest food insecurity rate in the country. The national average is about 10.5, and we're closer to 16%. If you look at specifically children in the state of Louisiana, we know that a significant proportion of our kiddos in Louisiana are living in poverty, and that results in a pretty high hunger rate for children, 2nd highest as of 2020. And then because I need to hit on this other vulnerable population, so much of my work is around moms and babies, as you'll hear me say, because I do oversee WIC, but I also oversee the Commodity Supplemental Food Program, which is for seniors. And I do often think that that population in particular can be overlooked related to this issue. So Louisiana is in the top 5 states for the highest senior food insecurity rate, not quite at 10%, but close. And the New Orleans Metairie area, so what us in LDH, OPH call like that region 1, the southeast part of the state, does typically have the highest rate of senior food insecurity. Next slide. Okay, so this is a map that is specifically found it through, or we have sourced it from Feeding America, and just looking at the orange dots, those are locations of food banks in Louisiana, or the main food banks in the state of Louisiana. That doesn't mean that that folks in the other parishes that don't have an orange dot can't access the services provided by the food banks. That's just where like their main location is. So for example, the Greater New Orleans, or Second Harvest of Greater New Orleans, and I think Acadiana is the full name of their organization. They're that dot on that southwestern part, or southeastern, I'm sorry, part of Louisiana, and they provide services to the Greater New Orleans southeast area, and they reach and provide services into Lafayette, so getting into Southwest. I thought that was a nice map to at least give you an idea of not only where the food banks are, but also just that food insecurity rate by parish. And you'll see that I'm actually shocked that some of our parishes aren't darker than that. And I would be interested to see what this map looks like now. Because again, I believe this is either 2020 or 2021 data. But food insecurity is most prevalent in rural areas of our state. Most of us have probably heard of the term food deserts. Folks in rural parts of Louisiana often live further away from grocery stores and food pantries. We see in the WIC program, when we authorize our grocery stores, for example, to provide that service, we're seeing a lot of the independent mom and pops closed down. They don't always have access to what we would consider like a full line grocery store to meet all of their food needs. And oftentimes they have to rely on discount stores, dollar stores for food access in these rural areas. Food desert is a term that we've used for a long time, but USDA also has coined the term a LILA, which is a low income, low access area. And it is based off of census tract data, looking at median income, and also looking at hunger rates, and trying to identify, again, where are our areas of highest need. That could take up a whole presentation, so I won't go too much into LILA, but please do look it up, LILA. There is some really great information and maps that show you, if you're interested in specific parts of the state, you can look at data specific to those areas. We also know in rural areas, just a lack of public transportation, so it's harder to get to a grocery store that might be available, or a food bank. And then the jobs that we see in rural areas typically pay at lower wages and maybe not even have full-time hours. So in the United States as a whole, 9 out of 10 counties, parishes, with the highest food insecurity rates are rural. And I'm talking to you all who work in those areas and understand that population. So probably not new information for you. Next slide. And probably the next one after this. So I have an overview on each of these next few slides of different federal feeding programs. My staff know that I love to spread what I call spread the word of WIC, the good word of WIC, the good word of all of these programs, really. It's kind of shocking to me at times how little our providers know about what is available out there related to food access and nutrition security. And so I have to always remind myself to put on the hat of not everybody knows what I know. And I want to share that information with everyone else. So the first slide after this one is probably one of our largest programs in the state of Louisiana, behind SNAP, which I'll get to later. This one, the Special Supplemental Nutrition Program for Women, Infants, and Children, what we know as WIC, we operate throughout the state of Louisiana. We have about 100 clinics throughout Louisiana that provides the clinical services of WIC, so the health screenings, the assessment of nutrition risks, because that is something that we need to look at for those who participate in our program. We tailor food packages and issue food benefits at those clinics. And those families and individuals who receive WIC benefits can then take now their EBT cards for WIC, because it is different than their EBT card for SNAP if they're in both programs, and use those benefits at one of our 427 WIC authorized grocery stores throughout the state. So we are funded by the USDA's Food Nutrition Service. You'll notice a pattern throughout all of these programs that most all of them are funded through USDA FNS. And we are housed in LDH OPH. This monthly average is actually going up. In the calendar year 2023, we served on average about 95,000 people in WIC in Louisiana. Pre-pandemic, that was closer to 100,000, 110,000. And we're getting closer to 100,000 now in calendar year 2024. We saw a dip in our participation during the pandemic because a lot of folks were relying on pandemic EBT and their expanded services with SNAP. But that ended in March of 2023. And as expected, we started to see folks come back into WIC. We serve folks who are pregnant, breastfeeding, or postpartum. Those are women, and then infants and children up to the month of their 5th birthday. So not through their 5 years of age, but up to when they turn 5. And they do need to meet income eligibility requirements. Not only showing proof of income, or they can show proof of income for this 185% of the federal poverty line. But one thing that I like to share with everyone is that in order to income qualify for WIC, if a family is on Medicaid or SNAP, they automatically income qualify for WIC, which dramatically reduces the burden of having to prove their income eligibility. If we can see that they are either on Medicaid or SNAP, we can automatically enroll them as long as they fit into, not automatically, it's not that simple, but it makes it a lot easier as long as they're fitting into one of these categories. We provide food packages, very specific foods, not dollar amounts, to our families, as well as nutrition education and breastfeeding support. Next slide. The other program that I oversee is CSFP, as mentioned, also funded by the USDA. We are serving around 38,000, probably a little bit more than that now, low-income seniors. So those are anyone who is 60 years of age or older, living below 130% of the federal poverty line. That's the commodity cheese that I think people have heard about, but it's so much more than commodity cheese. So those are USDA donated foods that we at the state agency work with USDA to procure and order. They get delivered, massive amounts of food, gets delivered to our CSFP local providers, where they warehouse and pack the boxes and distribute specifically tailored boxes of certain foods to our seniors each month. Nutrition education and referrals to other programs, much like WIC, is a major part of CSFP as well. The exciting thing that I can say about this program is for the first time in over 35, 40 years, we are expanding our local agencies. So Catholic Charities of New Orleans, for the longest time, was the sole local agency provider. They were reaching the entire state. They are going to be one of 2 providers coming up. So we're working with a new contract, or hope to have a new contract in place with Feeding Louisiana to expand these services, because we know that senior food insecurity is an issue in particular in Louisiana, and we can reach more folks by expanding our contractors and services there. Next slide, please. So I'll touch on SNAP. And I'll also use it from my WIC lens because I can't help myself, but the Supplemental Nutrition Assistance Program funded by the USDA, that's administered through DCFS and the Division of Family Services. They are serving a large number of participants each month. I'm sure it has grown, or if it hasn't grown, it might be just a little bit long, around the same amount from 2020, but nearly 900,000 recipients, individuals. They don't have the category restrictions that we have in WIC, or age limits. So these are households who meet specific income guidelines, and depending on the size of the household, and I believe the income amounts, that determines the dollar amount on their SNAP EBT card that they are able to use to get the food that they need for good health. So it is meant, it's formally called food stamps. We try to use the new terminology and just call it SNAP. Moving forward, but it is a rather large program. This program can operate in emergency mode. which is something that WIC cannot do. And so SNAP, when we have disasters, natural disasters or pandemics, they can expand their services and their eligibility to serve more people. And so I like to point that out too, that some folks who might not be eligible for SNAP during non-disaster times could be eligible during disasters. Excuse me. Next slide. And now we'll move into the programs that are funded by the USDA through the Department of Education. So the ones that we know is school lunch and school breakfast, nearly 9 million lunches served per month through the National School Lunch Program. I did work for the Department of Education for a couple of years in this area. We do have something available in the state of Louisiana, well, in any states, called community eligibility provisions, which typically would be what our rural parishes are enrolled in, because if you've got your school parish, your school board or your parish school board that has enough people where they can show that the majority of the students would qualify for free or reduced lunch, then they can provide free breakfast and free lunch to every student. So there is kind of the administrative burden of having every single family needing to submit an application, which is kind of like the older way that we did it, to determine if they're eligible for free or reduced lunch. Many parishes in Louisiana can now apply for community eligibility. So they're not having to go through that process of determining, okay, well, Joey over here is eligible for free, but then Betty is reduced, and then Jennifer is not, right? They just feed everyone and no questions asked, and we don't have to worry about it, and they still get reimbursed for that. So this program, along with school breakfast program, is meant to serve our school age children from 5 to 18 by providing nutritionally balanced, either low cost or free lunches each school day. And I'm sure continues to grow each year. And then the next slide, I believe I'm hitting on maybe the summer food service program. Next slide. Oh, there it is. Okay, so not summer food service just yet. Child and adult daycare food program. There's 2 slides on this, but it's also USDA program where we are, I'm sorry, what we call sponsors are able to apply to provide this service to their families or their children. But CACFP, specifically for at-risk after-school meals, provides lunches and snacks to children 0 to 18 in a variety of care settings. So typically, and you'll see in the next slide that there's other settings where this program can exist. Typically, this is through after-school care programs where extra snacks are provided to kind of fill in that gap. If they're able to eat breakfast and lunch at school, but they're not going home right away, is there an opportunity for us to also feed them and give them a snack before they go home? And so I don't have a list readily available for which agencies participate in CACFP, but I have no doubt that I can reach to my partners at DOE and provide that information to you all if you are interested. Next slide. All right, so the same program, but this one is through daycares. So lunches are provided at those sites as well for 0 to 5-year-olds. And it's usually an established daycare or a daycare home setting. So there's an application process. Basically the daycares and the daycare homes, as well as the schools that I mentioned earlier, are reimbursed for providing these meals, and all of that administratively is handled by the Department of Education and their Division of Nutrition Support. Next slide. Here's summer food, and probably something that might be on y'all's minds, and I was kind of anticipating might be a question, but the Summer Food Service Program, CFSP, also operates through LDOE. They provide lunches during those summertime months. So any child 0 to 18, it's a free meal, and usually in low income areas. We've got sponsors that they've got to apply each year to be a SFSP provider, and it's usually during the summer months when school is not in session. You may have heard of summer EBT That is a brand new program that USDA is launching, not to be confused with the summer food service program, but it's essentially providing, and it was something that was provided during the pandemic, EBT benefits during summer months, to allow for families to provide, again, that basic need of food, throughout the summer when they're not able to access meals, snacks, from school, when they're not in school. Unfortunately, Louisiana is not moving forward at this time with establishing summer EBT. I'm hoping, and that's not something that LDH has any involvement in, but I'm hoping in the future, once we see that it's not such a new program, and maybe some of the administrative burden of implementing such a program gets a little bit easier, that's something that we take advantage of in the future, but that's not something that we're doing right now at this time. Next slide. TFAP, the Emergency Feeding Assistance Program, is a USDA program the Department of Agriculture and Forestry oversees. So I have some information here about their monthly participation and their eligibility requirements. So households under that 130% of the federal poverty line, they're providing emergency food assistance at no cost. So I mentioned CSFP, we get foods donated by USDA that we order and the local agency kind of distributes for us. The same thing happens with TFAP. So a lot of food banks and that Feeding Louisiana Food Network already operate TFAP, where they are ordering USDA foods and then distributing them via local food banks and soup kitchens to the public, to those who are eligible. So it's another program that I'm not always sure that folks are aware that exists, but it is there. And I see a hand up, so I'm going to pause before I go further and ask what your question is.
Hi, Jennifer, thank you. I just, on the news, and I may have it completely wrong, and you may have addressed it, but something about some, I don't know if it's a certain parish area or whatever, that we're no longer, legislatively, it's been decided that there will not be summer feeding for children that have gotten in the past. Do I have it wrong, or?
I think what we might be getting that mixed up with is what I was saying just before, right? That there is still the summer food service program, CFSP, SFSP, dang it, and then summer EBT. And so summer EBT was something that we were operating during pandemic time, if I'm getting it right. So y'all please bear with me too. And I can do a little bit more research to verify that I'm 100% correct. But the summer EBT program did exist, and USDA is making it a permanent program, and Louisiana has decided to not move forward with it being permanent in Louisiana. However, that summer food service program that I mentioned is still going to be operated through the Department of Education and could still fill in that gap where summer EBT is no longer available. Is that helpful? I know.
Yeah, and the rationale that we didn't participate is because of the administrative burden, or? Okay.
Well, choice is way above my pay grade.
I got you. Okay, all righty, thank you.
Yeah, but I do, from my partners in other states who are tasked with implementing summer EBT, it's quite a heavy lift. So, you know, for whatever reason that Louisiana and our leaders have chosen not to participate, I do hope that they reconsider once other states have gone through the process. We have some like best practices. This is what worked well. Maybe it'll be easier for us to do it in the near future. You're welcome.
Yeah, because I mean, it's interesting to me because if you go to the site where it has whom is participating, like a lot of states are. So I think it was for, you know, new legislation came in and there's some new things going on and thoughts and theories. And like you said, Jennifer, maybe at some point it will be reconsidered, but there is a lot of states that are participating. We just happen to be not one of them.
Yes, and there are, Angie, and I really hope that and I know the states who are participating are feeling really overwhelmed right now by needing to implement this. So I can see a little bit of both sides, but my heart wishes that we had chosen to do this right out the gate and not waited, even though it might have taken us some time to figure out exactly how we wanted to implement that. I think I have one last slide and I know we're right at time. So this is specific to the food banks. I know this isn't my last slide, but you'll get these slides. The last one, if I can, or the next one, Chrissy, is my version of call to action. What can you do? I think it's really important that we're screening for food insecurity at each and every visit, any interaction that we can have with any individual. I say, and Feeding America's CEO said it once when she came to our hunger summit, if you care about health, you have to care about hunger. A hungry person can't figure out health appointments and everything else if they don't even have that basic need met. So considering that when we're working with individuals and families, there are universal screening tools for food insecurity that are available. One specifically through Johns Hopkins. I'm sure there are others. A quick Google search. Staying up to date and aware of our programs and resources available for us in your communities and throughout the state is helpful. Making referrals, working with your community health educators, or I'm sorry, your community health workers, all of that's so important. But you know, as long as I am a dietitian and in this seat and caring as much as I care, if we don't care about food and if we're not caring about that, I find that it's really hard for us to move the needle anywhere else when it comes to health in Louisiana. So my last slide on this, Chrissy, just has my contact information. And again, y'all can feel free to reach out to me with any questions you might have. I know we kind of went over time here, but I appreciate it. And thank you so much for the opportunity to talk to you all.